I'm Sophie Ash, and I'm the host of our COVID-19 video series. Today's guest is Raha Janka. She's a public health professional who specializes in supporting immigrant communities with their mental health. Hi, Raha, how are you?
I'm doing well. Thank you so much for having me.
Great, no problem. So, for people who don't already know you and what you specialize in, can you talk a little bit about your background and what you currently do?
Absolutely. So I am a public health professional by trade, and I have about 15 years of experience in population health, health system strengthening, and also behavioral health. So a lot of my expertise is around designing, managing, and evaluating public health, and specifically also behavioral health programs in the US and across many different countries. So I have geographic and cultural expertise in the Middle East and Central and Southeast Asia. I actually started my career in studying neurobiology and really studying and focusing on the molecular pathways of alcohol addiction. And I kind of continued on really towards a more population health approach and a public health approach with that interest, and kind of focusing on both health systems, but also primary health systems, and building behavioral health models and components within primary health care. So that's definitely a huge passion and interest of mine, specifically mental health, and really integrating mental health into kind of primary health in a more comprehensive way. So.
Thank you, that's great. And I know mental health is one of our main focuses in terms of this video series because, a lot of times the emphasis is put on the physical side of things, and there isn't as much recognition of the struggles that people can have with their mental health.
Absolutely. I think that for weeks we've seen elected officials, and really more than weeks, for the last couple of months, elected officials and public health experts offer updates on the COVID-19 pandemic and urging residents to stay home and maintain social distancing measures. And we're all definitely doing that. But it's not a given that those potentially life-saving messages are reaching everyone, especially immigrant and minority communities, and those also groups whom English is a second language. So I think that, we see that mental health is certainly, accompanies a pandemic like this, and it can be far reaching, but I think more so for immigrant and minority groups. And when I say that, I mean, I'm talking about a whole host of different groups. I think that could be detained immigrants. I think that could be, poor or immigrants living in poverty, the Black community, Native Americans, immigrant groups from the Middle East, homeless families. And that's just to kind of name a few groups. But we're definitely seeing, I would say, a huge class divide, especially in terms of access to information, misinformation, lack of resources, and of course, language barrier, which is a big one as well. So.
Thank you. And so, thinking about the pandemic in particular and the current situation, what are the specific challenges that you feel people are undergoing at the moment, particularly in the immigrants kind of category?
Sure. So I think that, we know that immigrant and minority communities already encounter a lot of different challenges as it is. So, you're seeing discrimination on a number of different levels. And I can speak from experience, just, the number of times I've been told in the course of my lifetime to go back to my own country is astounding. Even today, you're seeing economic and financial issues that they're suffering from already, lower access to healthcare, due to lower paying jobs without benefits. And now we're seeing that, it's a complete loss of job, and potential visa issues as well. And I think a huge focus, I would also say, is around the lack of understanding and knowledge and deep-seated stigma around mental health and mental illness. And I think all of those things collectively are exacerbated quite a bit when you have a situation like we're under right now. So, you're trying to manage the challenges of assimilating to a new home, including isolation from the larger national community. And then you're forced to stay home and engage in social distancing, which really reinforces that sense of separation. And as it is, and again, both we see this in the research, as well as the experiences that I've had, as well as just in my career and on a personal level as well. I think that many immigrants are far less likely to seek treatment or trust the government or really trust the healthcare system as it is. And this is, again, this adds to just, the host of issues that they're already facing. So when it comes to mental health, I think there's also a lack of cultural understanding and competency that is something that is important for them. Insurance and the cost of care could be another hurdle. Lack of culturally or linguistically appropriate mental health professionals as well could be a barrier. Their fear due to immigration status. And most commonly for most of us we're from countries where there's insufficient mental health treatment or education to begin with. And it comes with such a deep level of stigma, guilt, and shame in the community, and so many different stereotypes that all of those things become heightened or exacerbated during the pandemic, because you have nowhere to go. Some people don't even have a private space or their own home to live in right now. They're really struggling. So it's just, what do you do with all of that? And how do you manage it? Where do you access the resources? And I think it's, these are just a few challenges to name just, some of the ones that I've come across just in the course of my professional career, as well as what I'm seeing today as well.
Thank you. Yeah, I mean, it feels overwhelming just to hear about all of it. I'm not going through it myself, but I can't even imagine how overwhelming it must be for some people at the moment, and feeling lost and not knowing where to turn and what's available to them, and how to take advantage of that. So in the second half of the interview, I would love for you to share some resources or advice or recommendations so that people who are watching this at home can do something to improve their mental health and help them get through this difficult time.
Yeah, absolutely. I think that it's really, something that is of great importance is the role of stigma, and the lack of education that we see around mental illness and mental health. And it's just, for a lot of communities, minority groups and immigrant communities, it's not something we ever grew up with. But I also see that, there's the expression of these things. Sometimes I think it takes a level of cultural competence to see how something is being expressed. Oftentimes we see the expressions of distress in different communities, also referred to as idioms of distress, which indicate kind of manifestations of distress, which are wrapped around personal and cultural meaning for that individual. And this can really impact help seeking and diagnosis and treatment. And I think social workers and therapists and psychologists alike certainly are, and hopefully will continue to gain more knowledge and have cultural competence in identifying some of these idioms of distress. And I can just kind of give you a couple of examples. Just even as a first generation Iranian American, I can tell you that sort of in Iranian culture, as well as across many countries across the Middle East, we have the idiom of heart distress, as we call it, which can be connected to a whole host of issues around grief and loss and even depression. And many of these idioms are often associated, again, with the heart, or as we refer to as the del. You hear phrases like del dard, which is pain of the heart and abdomen region, or dar de del, which is sharing or venting feelings and emotions from the heart. And these idioms of pain are really, they focus on different regions of the body, but they also reflect or manifest in terms of a metaphor, sometimes the grief and depression and anxiety that someone is really dealing with, which can be heightened during this situation. So I think that in terms of guidance and advice, there's certainly a lot of barriers, but I think it's tapping into these nuances of different cultures and responding to communities in a culturally competent way, I think is really critical. And I want to say that, to immigrant and minority communities out there, that there are so many different groups, including, government resources and groups that embrace cultural diversity. And they're committed to helping immigrants with their everyday challenges, especially during this pandemic. My first kind of bit of advice really is focused on access, and I think it's really important to have that level of access. We live in a digitized world, and technology is such a significant part of our everyday life, really. And I think that it's hard to give advice about, okay, well, where to go or what website to go to and how to access a therapist, without really touching in on, well, do these communities even have access to the internet or phone or telecommunication services to be able to access the rest of the knowledge and resources out there? So my first bit of advice is learning about available government resources that can provide that level of access for you. I would say that telecom companies are providing free and discounted services during this time. So I would absolutely check with your provider. You can reach out and ask carriers what their policies are. And there's a lot of companies that have Spanish language customer service representatives and Arabic language customer service representatives that can help. There are programs such as the Subsidized Federal Lifeline program. This is a program, it's a federally funded program, but it provides a $9.25 subsidy for low-income households to get telecommunication services. So this is landline and wireless phone only. Some states like California are expanding that to wireless. So being, just aware of the fact that, okay, well, look, there's this Lifeline program I can contact and I can be connected. I can be connected to the outside world. I can be connected to Wi-Fi. I can be connected to broadband. And I think being, tapping into some of these resources is really critical. In addition to that, I think once there is access, we see that a lot of immigrant and minority communities may have distrust of the government. So certainly your first outlet, your first resource may not be to call the government for help. And in that sense, I highly, highly encourage looking into mutual aid groups and hotlines. I'm currently actually a member of a mutual aid group that is in my community here, the Washington, D.C. Mutual Aid Network. I specifically work in my neighborhood, in my community, Ward 6, doing a lot of work with this group. So mutual aid groups are, of course, springing up across the country with a focus on solidarity and not charity. They are not nonprofits, they're not charities, they're not NGOs, but their concept as a whole centers around reciprocal sharing and what we can do to help meet each other's needs in a self-directed grassroots way, rather than kind of relying on this exclusive, top-down government solutions that some people may either not trust, or the resources are coming too slowly, or it's just adequate support for immigrant and minority and vulnerable people. So it's about getting together as a community and as the neighborhood and meeting each other's basic survival needs with a shared understanding that the systems that we're living under may not meet all of our needs, and we need to do it together. So
Mm.
I very, very much suggest looking into these groups. There's a hotline that that I actually work myself. I collect information. I collect the needs of the community, and I think tapping into what's in your neighborhood right now is certainly a great next step, especially in terms of access to mental health services. Where can I go to connect with a counselor? Where can I go, to connect with whatever the need is? And just in line with that, I would also, say other trusted grassroots organizations certainly can be of help. Religious institutions, churches, mosques, temples, synagogues, counseling centers. You see a lot of community centers and online community groups. Um, and all of these kind of groups are here in solidarity to work with people, not just on their food needs or their rent needs, or helping pay their bills, but also tapping into spiritual support and sort of existential and emotional support and guidance during a very challenging time.
Yeah, absolutely. Thank you for sharing. We have a couple of minutes left. I wonder if you could give the listeners a specific example of something that they might find to be helpful. Say that they discover a community or a group like the one that you're involved in,
Yeah.
and they, I imagine, would be part of a forum discussion type of thing. What kind of thing might they expect to gain from that, in terms of helping them right now?
Yeah, absolutely. So I think it depends on the individual. If if you feel isolated and you're looking to connect, my advice in terms of from a mental health perspective, as well as kind of connecting with the community, would be certainly to call a mutual aid group or hotline, but also now that you have access, as we talked about, is really more so to kind of look into options, either through mutual aid or get guidance from mutual aid or other groups on how to access individual therapy, group therapy, or telehealth services.
Mm-hmm.
And there are a lot of trusted grassroots organizations and institutions that are providing this level of guidance, kind of in that direction. I think if you are not insured, you can certainly look for free clinics and counseling services. Federally qualified health centers are offering care right now, including mental health and substance use treatment. You can actually look this up on fqhc.org. I would say that many of these groups that I've just discussed also can refer people to crisis or national crisis text lines. They can connect to a crisis counselor for free. You can actually, text crisis right now to 741-741. And these are staffed by volunteers and providers and health providers and social workers 24 hours a day, 7 days of the week. And this is certainly an option. Telehealth therapists are absolutely available. I know some of the community groups that I work with right now are actually guiding people towards telehealth therapy if that is a need. So apps like BetterHelp or Talkspace or Doctor on Demand can definitely be helpful. And I would say there's often this concern with healthcare, like I need to talk to someone, or I need to be counseled, or I just need to get it all out, or I need to connect with someone. I think there's a fear around cost and insurance. And I say that, if you are insured and you have a Wi-Fi connection, your insurance company can give you a list of therapists who take your plan. So don't be afraid to give them a call, to interview the therapist, to ask if they have experience with your culture or your specific issues.
Mm-hmm.
I would also say if you're not insured, again, don't be afraid to, access free services out there. There's a lot of young people that are looking for support. If you're a student, counseling centers are free at most schools, and many colleges actually have low cost and free clinics with therapists in training. Many hospitals also have free clinics as well. So there's definitely a whole like host of different options that are available to you, both when it comes to kind of therapy, telehealth services, as well as just connecting with your community to getting your needs met. So.
Thank you so much, Raha. This is, I'm sure, going to be very helpful for so many people. I actually use BetterHelp myself. I've tried out a number of different services, and yeah, there's so many different price points, different levels of support, different things available out there. So yeah, definitely check out some of those resources and join some of those groups and communities and seek some of the support that you need. Thank you so
Absolutely.
much, Raha, for being with us today.
Thank you so much for having me.